Good morning. My name is Dennis Hammond from Grand Rapids, Michigan, and I'd like to welcome you to our video channel regarding educational aspects of aesthetic and reconstructive breast surgery. And today what I'd like to do is talk about the concept of bottoming out. Sometimes when we see patients that have had previous breast surgery, we notice that the breast seems to have drifted down onto the chest wall like this, under the influence of the weight of the implant. And as a result, the implant seems to be positioned too far down on the chest wall, and it creates an appearance that we call ptosis. And this is in large part due to the type of implant that we use. So you can see that with the implants that I have arrayed here on the table. This is a salt water filled implant. It has a little blue dye in it, so it appears blue. This is your typical round, smooth silicone gel implant. And this is an anatomically shaped implant. The gel is a little bit stiffer inside, and some people have referred this as a gummy bear type device. Well, you can see what these are going to do in the body simply by just lifting them up and letting them drop down. When a patient has a saline implant in, every step that she takes, all of the weight of the saline is directed to the bottom of the breast. And over the span of years, this constant pounding of that saline against the soft tissue leads to this kind of a situation where the implant, which initially was up here, is now down here as it stretches that soft tissue, and then the breast has a saggy kind of appearance. This is one of the main reasons why I try to avoid using saltwater filled implants if at all possible. Conversely, when you use a silicone gel implant, because of the nature of the gel inside the shell, when this has a downward directed force with each step of the patient, there's much less force directed on the bottom of the breast. Some of the force of that downward step, that gravity, is absorbed by the gel. So you can see the difference between the two here when you go drop them both together. And this is one of the reasons why the silicone gel implant has an advantage over the saline device. Even better is a cohesive anatomic gel implants. Because the gel is a little bit stiffer inside, when this is directed downward, there's hardly any force at all felt on the bottom part of the implant. So that when this is put in, there's no force present on the bottom part of the breast, and therefore you see very little bottoming out with this type of device. So when this kind of an implant is put into the breast, it will stay right where you want it. It will stay up, so it will create the pleasing breast shape. So of the three kinds of breast implants, the one that causes bottoming out the most is the saltwater filled device. These are much better options as far as stabilizing the shape of your breast.